It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question in this series of questions from my client Melissa. And the question last week was part 2 of my 78-year-old mum has lung cancer and developed an infection. She's in ICU on the breathing tube. Can she get off it, or will she need a tracheostomy? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the next question in this series of questions from one of my clients, Melissa, which are excerpts from phone and email counseling and consulting sessions with me. And the question this week is part 3 of my 78-year-old mum has lung cancer and developed an infection. She's in ICU on the breathing tube. Can she get off it, or will she need a tracheostomy? So Melissa writes, "Hi, Patrick. Thank you for your email and your phone message. We just got home and have to speak to some family members, so we'll have to call tomorrow, but they are holding off on the tracheostomy until we can be there for it. I re-signed my permission for now. They did share the chest x-ray results. Their position is physical therapy would not make a difference, and she is too weak to do much. I know they have beds to fill, but what I don't get is they get paid either way, no matter who's in the bed. What's it to them who it is? I think the doctors are sick of our questions, quite frankly, and they seemed exasperated with us. But we need to have the facts. My mum does want the tracheostomy, so we will most likely do it in time, maybe in the next few days, and most likely next week. Do you and other advocates at your IntensiveCareHotline.com also talk, not just to the doctors, but to the long-term care places? For example, we would want her at this specific place. This doctor says she has only a 10% chance of getting in because they do an evaluation and only take people who they feel have a high chance of getting better. But they look for the doctor's recommendation, although it depends on other factors too. And this doctor we're dealing with would almost certainly give them a negative report. Would you or any of your other advocates get involved in things like that? We will call you tomorrow, and I have also copied my dad in this email. We did also get her oxygen level in the blood, and it is 3 points higher than you said it needed to be, so that's a good sign. Many thanks from Melissa." So before I get into my answer of Melissa's questions, please also have a look at the one-on-one counseling and consulting options that I offer for you. And if you have a family member in intensive care, I know I can help you very quickly. Go and check out the phone and email counseling and consulting options on the top of the website. So here's my response. "Hi, Melissa. I can certainly talk to the doctors in this ICU, and I believe they are not open and transparent, as I mentioned to you before. I can certainly talk to any of the facilities where your mother may go to, so that you choose the best possible option. I can talk to whoever you want me to talk to, of course. But I believe we need to start with the ICU doctors to still try and avoid the tracheostomy if possible at all. Again, if they followed best practice like I described in an article and video, how to wean a critically ill patient in intensive care off the ventilator and the breathing tube, then at least they would have maximized her chances of getting your mother off the ventilator and extubated. I have tried everything. If they have tried everything they could, the tracheostomy will be the right next step. If they're trying to avoid your questions, it looks like they have no interest in your mother's situation, and all they want is to have her leave intensive care, whether it'll be going to hospice or by going to long-term acute care. As I mentioned before, it's all in their hidden agenda, and all they usually want is to empty the ICU bed, period. They would never openly admit to it. However, as I have said over and over again, ICU beds are in high demand, and as you know by now, they don't really want to deal with you because you are being perceived as way too difficult and demanding. But that's the only way forward. You are now slowly moving into the 1% bracket of families in intensive care who do make informed decisions, who get peace of mind, control, power, and influence quickly. Therefore, take it as a compliment because you are speaking your truth and they simply don't like it. They know you've got the right questions. That's why they are trying to avoid you. Your ability to read between the lines will give you most of the answers you are seeking anyway. Keep watching for their actions and behaviors and not so much for their words. You are also saying that it would be too difficult to do physical therapy. Well, Melissa, this is a very good point, and that's exactly why they need to start doing physical therapy as soon as possible, because your mother is so weak. How do you think she'll actually get stronger again? The only way forward is through physical therapy in order to build up her strength. Everything else is simply an excuse. Of course, the doctors are exasperated with you because you keep challenging them and they quite frankly don't like it. They know you have all the right questions that they need to answer. I appreciate that you rescinded your consent for the tracheostomy for now, but please keep in mind that if she does need a tracheostomy, it can be done really quickly, usually within less than 90 minutes for somebody with experience. I do believe there needs to be a family meeting where I can call into so that they can't hide. The questions that I've given you are basic questions, and I can go into way more detail once you've engaged me further. We are just scratching the surface here, and there's so much more to ask and to find out. Everything that happens or doesn't happen in intensive care, every communication that happens or doesn't happen in intensive care is simply a result of what's happening behind the scenes in intensive care. If you don't understand what is happening behind the scenes in intensive care, you'll have a very difficult time understanding and interpreting any information correctly and accurately, and it will hold you back. Therefore, it matters a great deal who is occupying their ICU beds, because the best occupancy for ICUs is to have quick turnovers where patients don't stay for very long, because it tends to be less hassle and also more profitable, or at least more cost effective. The longer a patient stays in ICU, the more difficult and complicated a situation can get, clinically as well as emotionally, including from a family perspective. Also, some patients attract higher payments and fees than others. It's as simple as that. The longer the intensive care stay, the more is at stake, and the more you and your family need to understand the clinical issues at hand. Because if you don't, the intensive care team will do it for you, and they can pretty much tell you whatever they want. Keep doing your own research, which I know you are doing now anyways. Ask the right questions and position your mother's diagnosis, her prognosis, as well as her care and her treatment going forward, and you have a much better chance to get what you and your mother want, need, and deserve. If you don't do it, the intensive care team will do it for you, and as you can already see, it's causing friction. You will only get the facts if you keep asking, even if they are resisting. If you don't get the answers on the first go, try again. It's as simple as that. Like with many things in life, things may not happen straight away. I know you are under pressure, but don't give up. If you give up and don't try to get the answers that you want straight away, you'll go right back to the 99% of families, critically ill patients in intensive care, who make no informed decisions, who have no peace of mind, no control, no power, and no influence. Also, keep coming back to those articles and videos about when to do a tracheostomy, this information will help you tremendously to continue asking all the right questions. The articles and videos are, and I put links below this video in the written version of this blog, or if you are watching this on YouTube, just click on the link below. It'll get you to our website where all the information is accessible for you. So the articles and video you may want to check out about when to do a tracheostomy are: how long should a patient be on a ventilator before having a tracheostomy? The next article and video you may want to look at is: how long can a breathing tube or an endotracheal tube stay in? The next article and video you may want to check out is: why would a critically ill patient in an induced coma need a tracheostomy in intensive care? And last but not least, have a look at what are the risks and benefits of a tracheostomy. I'm looking forward to talk to you tomorrow, Melissa, and I'll talk to you then. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power, and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what is really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on the Contacts tab. Also, check out our ebook section where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone, or via email by clicking on the Products tab on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.